And I've been in private practice now for over 30 years. When fluoride came into the system, you saw a drastic reduction in the severity and how big the holes in the teeth were. And now we're back to where we were without the fluoride in the water. The cavities not only are there, but they're bigger and deeper. I'm seeing a lot of mothers coming in and fathers that 4 and 5 year olds where they're wondering why their child has so many cavities or holes. Kids are suffering the most, and certainly you're seeing effects in the adult population too.
Hands down, it's the people of low income, Indigenous people, children, particularly children in those groups.
Is the kids who are in pain that could have been prevented with water fluoridation.
It's across the board. There's nothing selective about what patients' economic background, educational background.
The elderly, people with long-term disabilities, people with developmental delay who live in care homes, long-term care.
It's happening to everybody.
I think everybody is suffering.
What I would say to council about fluoride and how to convince them, I grew up in Winnipeg that has fluoride. I went to dental school in Winnipeg and also practiced general dentistry in Winnipeg. And when I moved to Calgary in 1989, there was no fluoride in Calgary. You were immediately aware of the difference in the number of cavities, the size of the cavities, or the number of teeth that are missing in patients in Calgary compared to Winnipeg. I saw with my own eyes the difference in what fluoride can make in someone's general dental health.
As an oral and maxillofacial surgeon, we're really the final stop for any people who have really severe dental disease. I think it's ethically and morally the one thing you can do to help people have better dental health, which then has repercussions on their overall health.
As a dentist who specializes in treating kids, there are two main reasons why I feel that the kids benefit the most. Number one is fluoride that is in our water. The fluoride that we swallow helps to make the teeth that are growing stronger. That fluoride actually gets incorporated right into the tooth to make it stronger. The second reason is if you have ever tried to brush a kid's teeth before, it's very challenging. And if parents could have one more tool in their box to help them prevent cavities, it would be fluoride.
If you've ever had dental pain from a cavity or a toothache, you understand the exquisite nature of the discomfort and pain that people can be in. And this is the one thing that you can do to help reduce that pain.
When Calgary did have fluoride in the water, it was rare that we would ever see a patient that would have holes in their teeth to the extent where we would need to stop treatment, take their braces off so they could get those holes fixed. Now, with the fluoride gone, it can be as many as 1 or 2 patients a day that we see that have so many holes in their teeth that we cannot continue treatment, we have to take the braces off, and once their teeth are corrected and treated, then we can entertain potentially continuing their treatment.
I have examples every day of kids who come in who are in pain. The ones that scare me the most are the ones who have infected or abscessed teeth, especially on a lower tooth. That swelling, I've seen kids with their cheek puffed out. That swelling can actually be inside as well and start cutting off their windpipe. And then kids can't breathe.
Certainly when you talk to ear, nose, and throat specialists, they're also being inundated with it as well. There's people with facial swellings from the dental infection from the abscesses that are created.
I've had to send kids to the hospital for IV antibiotics. And let me tell you, that's a tricky message to deliver to a parent, to tell them that their child is in grave danger because of an abscessed tooth.
So yes, I have 4 children. My oldest, she's 13. She had the fluoride. She hasn't had much problems with her teeth at all, actually. And then my 8-year-old Alicia, she had a root canal at 4 years old. She was in quite a bit of pain. And then my daughter Mia, she's 3. She's going to be going for surgery. Keeps her up at night. She cries in pain because her one tooth is pretty decayed. She's getting one tooth pulled, 4 cavities. And it's hard as a parent to try and keep on top of brushing their teeth. And there was fluoride in the water. It'd be a little bit helpful, more helpful. It's scary getting a 3-year-old to go in for surgery, and I think it probably would have been prevented if there was fluoride in the water. To be honest, I don't know why they took it out in the first place. I think it should have stayed in the water.
It's a terrible process for the kids and the parents to have to go through.
It's unnecessary. There is no reason that patients should be suffering and having to go to all the extensive work and cost and time it comes into fixing their teeth when something as simple as fluoride in the water can prevent this from happening.
If the fluoride is in the water, they're going to have access to it just by eating and drinking.
I am imploring City Council to add fluoride back into our water.
Hopefully it comes back so that this one doesn't have to have any problems with her teeth, hopefully.
Awesome. Good job.
Yeah, okay, I'll talk to them.